In today's news, Thailand shrugs off the notice by the US to avoid traveling to Thailand. The finance ministry approves of tax breaks for crypto trading in the kingdom, and the health ministry plans to declare COVID endemic by July 1st, but with Thai-style rules. Details on these stories coming right up. You're watching Thailand News Today, bringing you the latest top stories in Thailand and beyond. My name is Jet Gunther, and in our first story, tourism officials have shrugged off a US CDC notice which advised citizens to avoid travel to Thailand. Earlier this week, the US CDC added Thailand to its list of level 4 countries due to the ongoing COVID situation in the kingdom. However, Yurasak Supason from the Tourism Authority of Thailand says that won't make much of a difference to an already weakened sector. According to a report, Yurasak says the advisory is the same as that issued last year when Thailand's infections peaked at over 20,000 cases a day. He does not believe the move will have a significant impact on people's decision to travel, adding that rising inflation and the increase in travel costs due to surging oil prices are more likely to affect international tourism. He admits that numbers may end up 30% below the TAT's target of 330,000 foreign tourists expected in the first quarter of the year. The Thai government has approved the easing of tax rules for digital assets in order to promote and develop the industry, they say. The move comes amidst a surge in cryptocurrency trading in the kingdom, according to a Reuters report. Finance Minister Akom Pithiyapaisit says the relaxed rules means cryptocurrency traders can offset annual losses against gains in the case of taxes due on crypto investments, as well as exempting VAT of 7% for cryptocurrency trading on authorized exchanges. The exemption is effective from April 2022 to December 2023 and also includes trading of retail central bank digital currencies to be issued by the central bank. Reuters reports that there has been significant growth in cryptocurrency trading in Thailand over the last year. According to the finance ministry, by the end of 2021, trading accounts had jumped to around 2 million from just 170,000 earlier in the year. The most popular cryptocurrency in Thailand is Bitcoin. In related news, Akom has confirmed tax breaks for direct and indirect investments in startup companies in Thailand. That means those who invest in startups for at least 2 years can avail of a 10-year tax break until June of 2032. The Public Health Ministry's plan to make COVID endemic in Thailand by July 1st has been given the green light. The plan was approved yesterday by the National Communicable Disease Committee, giving Thailand under 4 months to downgrade the virus from pandemic status. According to Health Minister Anutin Chanvirakul, Thailand is adopting a policy of safeguarding the health of both citizens and the economy simultaneously, similar to what's being done in several other countries. He says that in order for the virus to be classified as endemic, a number of measures need to be implemented in the coming months. Thai PBS World reports that Anutin says life should continue as normal despite the existence of such measures. The health minister has also stated that even if the virus is given endemic status, the wearing of masks may still be required, along with avoiding mass gatherings, hand washing, and antigen testing, and vaccination. I can now sense the comments section screaming, "What is the point then?" Dr. Kietipum Wongtarit from the Health Ministry says the journey to endemic status will take place in 4 stages. The first is between now and April and consists of suppressing the virus to reduce the risk of severe cases. The second stage will be during April and May, when infections are expected to plateau and then decline. During stage 3, in May and June, daily new infections should drop to between 1,000 and 2,000. And finally, from July 1st or stage 4, Thailand will enter the post-pandemic phase with COVID classified as endemic. The health ministry says the virus will be considered endemic once the death rate is less than 1 in 1,000 patients, or 0.1%. The current death rate in Thailand is around 0.2%. Meanwhile, Anutin says there are still around 2 million elderly people who have not even received the first dose of a COVID vaccine. This population will be especially vulnerable if visited by younger relatives over the Songkran holiday. To address the problem, health volunteers are being dispatched to visit elderly people in rural areas to persuade them to get vaccinated.
Join the conversation and have your voice heard. Discuss the issues, share information, and get information. Thaiger Talk is where you keep in touch with everything Thailand. Go to thethaiger.com/talk.
Bangkok residents queued up to sell their gold for cash yesterday as the ongoing war in Ukraine saw the price of gold reach a new high. According to a Thai PBS World Report, Thais lined up outside gold shops along Bangkok's Yawarat Road to sell their gold items for cash. The report states that by 12:56 p.m. yesterday, the purchase price of gold bullion had risen to 31,850 baht, with a sale price of 31,950. According to the Gold Traders Association, the purchase price of gold adornment has risen to 31,275 baht, and the sales price has increased to 32,450 baht. The association predicts the price of gold will rise to between 32,000 and 33,000 baht should Russia's war in Ukraine continue. Prices are expected to remain volatile, with many gold market experts saying they could then drop again when the war ends. Between February 28th and March the 5th, the average price of gold bullion was between 29,350 and 30,250 baht. The price of gold was slightly lower the week before. UNICEF, the Ministry of Public Health, and other health officials launched a case management platform in Udon Thani Hospital today. The platform Primero will support social workers in working with children who are vulnerable to violent abuse. It will move documentation cases online, linking them with the hospital's information system. Primero will help children and families find resources both in and outside the hospital. Such resources are often complicated to access and disorganized. Primero will provide up-to-date information for caseworkers about violence patterns and risk factors so they can identify warning signs of violence early on and prevent serious cases. Children identified as at risk on another one of Thailand's systems will be transferred to Primero. Primero will then recommend what actions to take and work with one-stop crisis centers in hospitals to monitor the situation. Primero is already used in over 40 countries and territories. It is user-friendly and has clear workflows to help social workers document and manage cases. It helps with things such as identifying, registering, case planning, referrals and transfers, and case closures. There are many cases of family abuse in Thailand. In November last year, a 50-year-old man allegedly sexually abused his niece-in-law. A woman went to visit her father at a hospital, but when she came by, she found that the patient the hospital had identified as her father was not him. She found out later that the hospital accidentally switched the ID for 2 COVID-19 patients and that her father had died back in July and his body may have been sent to another family for a funeral and cremation. The woman, identified in Thai media as Tasupa, says her 66-year-old father had Alzheimer's symptoms and stayed at a nursing home. Her father and others at the nursing home were sent to Pathum Thani Hospital after testing positive for COVID in January. The hospital has been updating each patient's symptoms to relatives day by day. On Monday, Tasupa says the hospital contacted her to visit the hospital and spend the last moment with her father as he was in a severe condition. She went to see him, but says the patient on the bed was not her father. Tasupa took a picture of the patient and sent it to the nursing home staff who had taken care of her father for over 7 years. The staff confirmed that the person was another man named Bunna, who had lived at the nursing home as well. Tasupa contacted the man's family, and his daughter told her father had died in January and had already held a cremation ceremony for him. Bunna's daughter visited the hospital and was shocked because the patient on the bed was her father. The hospital has yet to confirm whose body was sent to the family for cremation. Pathum Thani Hospital has admitted the mistake and said they were sorry for what had happened. And that's all for our report. Thailand News Today will be back tomorrow with more headlines. Meanwhile, you're now up to date on the Thaiger.